she's bleeding from the mouth. I'm betting she bit her tongue. So I'm going to pull her jaw. She's pretty rigid and trismus there. So I'm going to have to do a lot. So let's get that O2 on. So she's stopped right now. I'm not sure how long that one was going. So things we need to get done as soon as possible. If you get that first head drawn up, I'll get her on O2. Let's get some.
There's a wide range of neurological assessments, and it really depends on the patient's presentation what we're going to do. But if you have a patient that is altered, then you need to start thinking about, okay, is this a seizure, or possibly are they having a stroke? But there's also a lot of other things that can cause alterations in patients from a mental standpoint. So we use the acronym AEIOUTIPS. This acronym stands for A, alcohol, acidosis, and arrhythmia; E, epilepsy, endocrine; I, infection; O, oxygen overdose; U, uremia; T, trauma, temperature; I, insulin, which is hypo and hyperglycemia; P, poisons and psychiatric; and S, strokes and seizures. This acronym is designed to help you narrow down the cause of the altered LOC, so you can ask questions or dig deeper into the possible causes. For example, alcohol, check the odor; arrhythmia, do an ECG check; epilepsy, ask the family. If they have an endocrine issue or thinking endocrine issue, check for a bracelet or ask the family. If they have an infection, check the temperature. Oxygen, check the SpO2. Overdose, check to see if they have signs of an opiate OD. Uremia, ask the patient is there burning urination, increased frequency of urination to see if that's a problem. Trauma, what's the mechanism of injury? Temperature, do a temperature check. Insulin, do a BGL to check if they have hyper or hypoglycemia. Poisonings, do a scene survey. Psychiatric, straightforward. And strokes, do a stroke assessment. Seizures, do a further history and an assessment. It's really all about identifying what you think could be causing the altered level of consciousness in the AEIOUTIPS assessment, and then doing further investigations in order to confirm or negate your suspicions, so that way you can continue to treat this patient.